Josh Holloman, and I am Deputy Director for Johnston County Emergency Services.
What departments do you oversee?
Johnston County Emergency Services is comprised of 3 divisions. So we have Emergency Medical Services, which involves the ambulances, like what's behind me. And so we respond to approximately 30,000 calls for service a year. So we go to all different types of medical emergencies that you can imagine. And in addition to EMS, our department also houses the Fire Marshal's office, which is charged with investigations of fires and also fire inspections around the county. And then our 3rd division in Johnston County Emergency Services is Emergency Management. And Emergency Management is charged in preparing for, responding to, and then cleaning up basically after disasters. So think about hurricanes, tornadoes, those types of things. Also chemicals. We have a lot of chemical plants and storage in the county. And so Emergency Management has to have plans for all of those types of things that may happen, and then be prepared to respond to that and then mitigate the disaster once it's happened.
Describe a day in the life as a deputy director.
A day in the life of being a deputy director for Johnston County Emergency Services. At first, just let me say it's a great job. I love my job, and 2, the path it's taken to get here. So I'm actually a paramedic by training, and that's how I started in the organization, is as a paramedic. And then so I moved on to become the training officer for our EMS division, and that was really great. Learned a lot there because I got to teach a lot of people, and that's a great way to learn things yourself, is teaching other people. So I love being a training officer, and then I served 7 years as the division chief for EMS, and so then had the opportunity 2 years ago to become the deputy director. So as the deputy director, I directly oversee the division chiefs of each division. So the fire marshal, who oversees the fire division, reports to me. The emergency management coordinator, who oversees emergency management, reports to me. And then, of course, the EMS division chief reports to me. So it's a great variety for me, because also having grown up and doing EMS, I've also always enjoyed the fire service. And so I get to be involved in that. And then also with emergency management, being able to prepare and do the planning process is something I really enjoy. And so that is part of what I get to do as well. So a typical day, there really is no typical day. Well, we sometimes plan for things, but sometimes you have to be flexible because the plan doesn't always work. There may be an emergency that we have to respond to. I don't respond to emergencies every day in my position, but I have to be prepared to respond to the big emergencies. One that comes to mind is we have Interstate 95 and Interstate 40, but we have a lot of big crashes. And so if there's a big crash with a lot of cars and a lot of people, and especially if it involves chemical spills and those types of things, then I would have to respond out there. Typically, I respond in some type of incident command component to be able to provide that overview of the management of the scene. But it's just, you never know when that's going to happen, so you really have to be prepared at all times. Otherwise, unless there's something like that going on, the day-to-day involves overseeing the budgets for the 3 divisions to make sure that the spending is where it needs to be, that we're not overspending, that we're buying the things that we need, such as ambulances and all the equipment that goes into it. And then also researching new equipment. So especially on our medical side, things are changing all the time. And so we want to make sure that we have the state-of-the-art equipment, be it a heart monitor, be it the chest compression devices, all types of things that are out there that are changing all the time. So we investigate and research that type of equipment, monitor the budget, make sure that we have paramedics and EMTs, so hiring people is a big part of what I do. That's a typical day.
What job opportunities are available at your facility?
So we have a lot of opportunities here at Johnston County Emergency Services. And one thing that comes to mind is with our EMS division. It's our biggest division, and it's where we have the most employees. We have over 200 employees just in our EMS division. And so the entry level into our EMS division would be becoming an EMT. And there's a couple different ways to do that, but the most common one is a 6-month class over at JCC. And typically it's a daytime or a nighttime class. They offer a lot of variety, but it's a great introduction to the field. In addition to doing the classroom time, you also ride on the ambulance with our EMTs and paramedics, and so you get that hands-on experience. We also do some shifts in the emergency department, so you get to do other more hands-on there in that environment. So that's a great way to start the profession. Past the EMT, then you can become a paramedic. And a paramedic is typically 2 years of training. So there are a couple options. There's a continuing education route, which usually is a couple days a week over at JCC. But then they also have an associate's degree option. And that's a little bit more involved. I think it's a little bit more time consuming. But they offer that over at Johnston Community College. And that's a great way, again, to get into the profession and kind of start what is a great career.
What skills are required to be successful in this role?
I think the most important skills to be successful at this job, especially as an EMT and as a paramedic, is first of all compassion. You have to really care about people because this can be a hard job, taking care of people, especially in the climate that we're in, with a worldwide pandemic. It's and a lot of other challenges on top of that. So you have to first just really care about people. And I think once you have that, and once that's really the foundation, then there are other things such as you have to be flexible, you have to be able to adapt, you have to be able to think about things quickly. We work under a doctor's license, but there's a set of protocols that we have to follow. And they're always there for us to refer to, but you have to have a good baseline understanding of the do's and the don'ts when it comes to giving medicines and bandaging wounds and things like that. But it really all starts with just really caring about people.
Perfect.
Describe the different equipment that is located inside of the ambulance.
This is our basic setup, and you'll notice on top of the bed here we have our equipment. And I'll go through what the different pieces of equipment are, but these are all of the things that they will take up to basically the person's house. That's usually what we respond to as someone's residence. And so they take the bed out, and then they have this primary gear that they can take off and actually take to the person who's in need. So in addition to what we have on the bed, basically the equipment that is in there is replicated throughout the ambulance. So in the shelves, we have basically what are in these things here in the bag. In case we don't need to do anything in the house, we can bring the patient out, and then we have the equipment around us in these shelves as well.
Why are these pieces of equipment important?
So what we have here, first of all, the stretcher system that we have is fairly new, and the reason we have this is because traditionally our EMTs and paramedics have a lot of back injuries. As you can imagine, lifting people day in, day out, that gets really bad on your body. So this is fairly new to our system in that these are called power loaders. And so you can see it didn't take a lot of work, physically for me to get it out. And then when I put this back in, it basically takes the load on the system instead of on the paramedic or EMT's back. So this is really new for us, and it's a great addition to our system. So that's why we have such a big piece here that I'll put back in the truck. Okay. So here we just have different pieces of equipment. So this is our heart monitor. Also our defibrillator. I'll just turn this on so you can get an idea. So we would take this in anytime it has anything to do with a heart-related issue or a cardiac-related problem, as we call it. And so we do this. We put this on the patient with these electrodes here. We have all the stickies that we have that goes on the person's chest, and we have some more that are in this pocket. So there's a lot of wires that go, but basically this allows us to see the electrical activity of that patient's heart. And so once we put that on the patient, then we get that across the screen here, and the paramedics learn how to interpret what that means. So just based on those, it looks like little squiggly lines if you're not familiar with what you're looking at, but as a paramedic you're trained to look and see what that means and what's going on with the patient's heart. So that's really cool. There's other things we can check, like how good the person's breathing. Also, this device will take someone's blood pressure. So this is a really neat machine here. Okay, so we take that into the person. All right. Here, now you'll notice that this is in a trash bag. This is one of our COVID precautions, just to keep it clean. But basically, what is in here is everything that's in that ambulance, which is kind of hard to imagine. But it's a big, heavy bag, and everything from our blood pressure cuffs to thermometers to stethoscopes to bandage equipment, all types of things that we have there in that bag. Then we have a little go bag here, which has some of those things that I mentioned. Now, what they may do, if it's a minor call or it's just a general illness type call and it's not anything involving a heart or anything significant, like where we're going to need a lot of bandage equipment, they'll just take this little light bag in. And this has the basic equipment that we need. We can check someone's blood sugar and basic vital signs and things like that. And then here we have an airway bag. So if we need to give someone oxygen, if they're not breathing well, we can use that piece of equipment. So for the EMT, this is your office. And again, it's pretty neat to be back here taking care of someone. You do get pretty close with the patients. Typically when we roll that stretcher in, our EMTs and paramedics sit right here. It just depends on what they're having to do to the patient, but this is usually where you're seated. And so as you take a look around, and I'll kind of start up here, we've got some different things to help us do our job here. So we've got oxygen. These devices here give oxygen to the person. And basically we hook the oxygen tubing in right there and turn it on, and we run that to the patient. So everything up here in this cabinet has to do with helping that patient with oxygen. So you can see a couple of our airway masks. That's actually for a pediatric patient there. That's kind of small. So that's the type of things that we have. Everything, of course, is wrapped up to keep it clean. That would be a breathing mask for an adult, but it's all right here so the EMT can get to it quickly. We've got some other things, so our communication devices, we've got our radios. It's important that we talk to our dispatch center. They know where we are and help keep us safe and tell us when there's an emergency to go to and all that.
What other resources do you have on board to assist patients?
These are our sharps containers here, so we do start IVs and sometimes give patients medicine. And once we're done with that needle, it goes right in there so we can be as safe as possible. Some other equipment here, you'll just see we've got things kind of put everywhere. Here's some gloves, part of keeping us safe as well. Here's an idea of the medications that we administer and that we have to know. There's over 50 different types of medicines that we have to know when it's indicated, when it's not indicated, the different side effects that can happen, what the dosage is. So a lot of things to know.
What tools in the ambulance are used to maintain communication with the hospital?
The one thing we'll do while we're on the way to the hospital is we'll actually call the hospital and give them a heads up that we're coming. And so we'll let them know, we'll be there in 5 minutes and this is what we have and this is what their complaint is, and we just give them an opportunity to be ready for the patients that we're bringing in. Up here, as you come over to the side, this is our needles. So if we're going to start an IV on someone, we're going to need these IV needles. Okay, we've got some different sizes there that we can choose from. And then if you look around on the very back here, these are our IV bags. So this is actually what we would the fluid that we would be giving someone in an IV. So we hook our tubing. We've got some tubing lines up here we hook in, and then we use that needle I just showed and start the IV, and then we push this fluid into the person. So if you're dehydrated on a hot day like today, this is exactly what you need. around on this side, we've got some basic things that you need. So sheets, to wrap folks up and keep them warm. Blankets, same thing. Keep folks warm. That's important. Of course, we can control the air in here for anything that we need. Over here's our basic bandage stuff. So everything down to a simple Band-Aid. So we have that, and then of course more complicated gauze pads that we have. We can do wraps, for injuries. Different sizes of wraps depending on what's going on. Ace wraps as well. So all of this is for that soft tissue type injury. We also have tourniquets. So if it's bleeding that we can't stop from a limb, then we can put this around and it gets really tight on the person's arm, for example, and it helps to stop the bleeding. Hot packs, cold packs, all of those things that we need there. And more of the same over here. So big thing of fluid, just sterile water there for us to irrigate a wound or like a cut. If you cut yourself, we can clean it up there. And then we kind of get back over here to where we started. So again, you really learn how to move around here, how to move around safely. You've got the padding here to help us. This comes in handy. We've also got the rails up here that we can grab onto. We've got the things here that come down for the IV bags. And so this is a unique environment to work in, but you really learn your way around and how to use your space as good as you can.
How does the front of the EMS truck differ from the back patient area?
So now we're in the front of the ambulance. And so first of all, there's some things to keep us safe. So anytime we're out on the roadway, we got to have these reflective vests on, so the cars can see us out there. And so we always keep those right there in our door. That's important. And then we come over, we've got a lot of switches here. And so one of the main things we want to do when we're on the way to an emergency call is we want to turn on those emergency lights so that people can see that we're coming. Hopefully we'll move out of the way so that we can pass safely. Okay. And so then in addition, we also have computers in our trucks, and as the driver, I'm going to be focused on where I'm going and getting there safely. But the passenger over here, the other EMT, is going to be reading notes about the call that we're responding to. So they're going to be letting me know what I can be ready for, as a team, what we're going to need to do. We're getting our game plan while we're on the way to the emergency. So there's a lot of things going on up here, but the main thing is to limit distractions here for the driver. We also have the siren, and then of course the radio here so that we can let dispatch know when we're on the way to the calls and at the calls.
What other rescue resources are available?
What they do is so the fire department helps us with any type of rescue. So whether you're trapped in a car, pinned in a car after a crash, or if you're stuck on the river here in Smithfield, they can help us out with that. And so this is a boat that they have that they can use. So this hooks up to the tailpipe of the truck, and what it does when the truck starts, all the fumes go up the tube and out the top of the station. So if we have folks who are here in the bay, you're not overcome by all of those vehicle fumes.
Questions?